This is Channel 7 News. Good morning, Arkansas.
Coming up, but today we're going to talk a little cosmetic surgery, talking about the differences in breast implants. Dr. Rhys Branman is here from Cosmetic Surgery Center. We're going to talk about the difference in silicone versus saline. We're going to talk about who is a good candidate for breast implants, who is not, and all those kinds of things in case you've ever thought about it. Dr. Rhys can tell us all about it coming up and talk about some of those questions you may have as well.
Yeah, there's always a debate going on there, and he'll hopefully clear some of that up.
Yeah.
When we come back on the show, Melinda and Dr. Rhys Branman from Cosmetic Surgery Center here talking silicone versus saline breast implants next on Good Morning Arkansas.
And welcome back. If you've ever thought about breast implants, you probably have a lot of questions about them first. So Dr. Rhys Branman is in from Cosmetic Surgery Center to answer some of those questions, or Dr. B, as a lot of people call him.
Right.
Good to see you.
It's great to see you.
Yeah, we're going to have you in periodically to talk about a lot of the operations and surgeries that people are having. And this is a popular one.
This is a very popular one, Melinda. This is breast augmentation. We're going to talk about some of the more common questions that I get on a daily basis about breast augmentation.
Very good, because I know the women come in and they're not sure what they want to do.
That's right.
And I guess the first question, silicone versus saline.
That's right. And if you look at these implants. This is a silicone one. It's filled with a silicone gel.
Right.
And feel how soft that is.
Oh, it is. Feels very natural.
And then feel this. This is a saline. It's a little stiffer.
It is stiff.
It's a little bit stiffer than the silicone is.
Right.
And the difference is that this gives a woman a more natural look. This is going to be a little stiffer look, but a lot of women still choose a saline because they're used to seeing that.
Right.
And also, they want a little more projection, or they want a little stiffer look to their breast.
So more natural look, maybe fuller look?
A little fuller look,
Okay.
a little more, some people say, done look. And some people like that, and so we go ahead and we give them the choice of the type of implant that they want.
Okay, and silicone, there were some health concerns many years ago?
Originally, there were health concerns, and then the FDA did a lot of testing, reformulated the implant, and now we have a very safe implant.
And now you do a lot of both.
And we do, and actually we're doing a lot more of the silicone because people like the more natural look.
There you go. Okay, let's talk about some of the other questions that you have in the office, and another one is over muscle or under the muscle?
That's right. Some women are very thin, and what we do is we take the implant, we place it underneath the little chest muscle here, and it gives them a little more coverage, and they don't see that implant quite as easily.
A little smoother look.
A little smoother look. And I think a lot of women are opting for that. But some women still want to be on top of the muscle, especially if they have a lot of breast tissue to cover that implant.
And and what about recovery time? Is it different?
It is a little bit different. I think it's a little bit slower under the muscle and a little bit quicker on top of the muscle.
Okay, but either one is good.
Oh, either one is great.
Okay, let's talk about sizes.
Sizes.
Because that's a big decision.
Oh my God.
Yeah.
Sizes
How big do you go?
How big do you go?
Yeah.
And that is patient preference mainly. But what we do is we look at what the available space is for the implant, and we'll pick out sizes anywhere from 250 cc's up to 500 cc's, and it depends on the woman's shape, how wide their chest wall is, and really those type of things really determine the size for a person, and also what they want to actually look like. And what we'll do is we'll do something like this. We'll put the implants in a bra, let the patient wear that, and then they can get an idea of how it feels, how it looks from the front and the side. And if you can tell that these are silicone implants, and they feel very natural.
They do feel natural.
And they really do. I mean, you wouldn't even know the difference.
Now, we don't know, women don't know CC sizes, but we know cup sizes.
That's right.
Can you sort of relate it that way?
We can to a certain extent, because you can go to JCPenney's or you can go to Victoria's Secret, and the bras are all going to be a little bit different. So what we do is we take one size, we actually ask the patients to bring in pictures and say, show us what you want to look like. And what that does is that really allows us to give them a size that they actually want.
Good, very good. All right, let's get down to our questions. Who are the best candidates for breast augmentation?
That's right. Who are the best candidates? I think the best candidates are women who are a little bit younger, in their 20s, who haven't had breast tissue and they want a larger look. Women who have had children and have lost that upper pole fullness, that fullness in the upper chest area. And basically, those women just want to get back to where they started.
Right, yeah.
They've lost it after having babies, and they really want to go back to what they looked like originally.
They don't want to add, they just want to go back to what they
That's
were
right.
before the babies came along.
That's right.
All right, and who would you suggest not to have a breast implant?
Well, I think someone who has a disease process, someone who's sick. I think someone who has just had a child and is still breastfeeding, that's a big no-no.
What about breast cancer patients?
Yes, and breast cancer patients. It's a very good point. We don't want to be doing surgery on someone who has had breast cancer. And I think that's a very important point to make.
Yeah, there are other ways that they can augment their look, for sure.
That's right.
And what about ages? I know that you won't do it under a certain age, right?
Yes, and especially for the silicone implants, we don't want to be going, there's actually a FDA rule that patients under the age of 22 can't have silicone. And that's just a rule that they've made.
And then under 18 for the saline?
And under 18 for the saline.
All right, there you go. A lot of good questions. We want to put up the information about Cosmetic Surgery Center because you guys do it all, not just breast implants.
We do it all, that's right.
Everything from facelifts to
tummy tucks, liposuction, and just what we talked about, breast augmentation.
A lot of people getting ready for swimsuit season right now.
Oh my God,
wanting
yes
to
they are.
fix some of those flaws.
That's right.
If you would like to do that, or if you just have questions, give Dr. Rhys, Dr. B, a call over there at the Cosmetic Surgery Center. I know his staff would be glad to answer questions and set up an appointment for you. And probably just a consultation is what you need first, right? Just come in and
that's
talk.
how, you know, we spend a good hour with our patients discussing all the options that they have, going over in detail all their questions, and it's well worth coming in just to find out the information if you're a candidate and exactly what we can do for you.
It doesn't mean you have to have it if you just come in and talk about it, right?
That's right.
I think that's a great point. All right, Dr. B, thank you so much.
Very nice
We're going to have him back on about once a month and talk about the latest in cosmetic surgery,
That's
some
right.
things you may want to think about. Thanks so much.
You're welcome.